Transcutaneous Pacing. To perform this skill, you will need the following equipment: an ECG monitor defibrillator pacer unit, ECG electrodes, a BP cuff, PPE, and a stethoscope. Monitor, defibrillator, and pacer operation may vary widely depending upon the manufacturer. Be sure to carefully review and follow all manufacturer recommendations before operating any monitor, defibrillator, or pacing unit. Based upon the patient's condition and local protocol, assess the need to pace. Pacing is often used when the heart rate is too slow to adequately circulate blood.
Sir, it looks like your heart's beating a little slower than we'd like to see. We're going to have to do some interventions to help speed your heart rate up.
To perform transcutaneous pacing, the limb electrodes must be attached. Let the patient know this procedure will be uncomfortable, and if appropriate, administer an analgesic or sedative. Position the defibrillator pacing pads. Place them in an anterior-anterior or anterior-posterior position. Often, the anterior-posterior placement is considered superior for pacing. Ensure the electrodes don't touch, and avoid placement over the patient's diaphragm. Turn the pacemaker on and adjust the rate as indicated in your local protocol. Often this will be 70 to 80 beats per minute. Observe the monitor for pacing spikes at the rate you've selected. Then adjust the energy level until capture is observed. Begin with 50 milliamps. Often, for a patient with a perfusing rhythm, capture will occur in the range of 55 to 70 milliamps. If the rhythm is asystole, some medical directors will suggest selecting the highest energy level and then dialing back. Always follow your local protocols. When capture is achieved, a wide QRS preceded by a pacer spike should be observed at the rate you've selected. Chest muscle contractions may also be seen at that rate. Run ECG strips at periodic intervals to document the ECG rhythm. Assess the patient for his or her response to the paced rhythm. Measure pulse and blood pressure in the right arm and ask the patient about pain. Administer an additional sedative as needed to maintain patient comfort. Avoid unnecessary patient movement after pacing is initiated. Continuously monitor the patient en route to the hospital.
All right, sir, how are you feeling now? Sir, it looks like your heart's beating a little slower than we'd like to see. We're going to have to do some interventions to help speed your heart rate up. Okay? And it's going to be a little painful, but I'm going to give you some medication that's going to help you not feel as much pain. And are you allergic to any medicine?
Sulfur.
Sulfur drugs?
Yes.
Okay. Sir, can you roll towards me on your right-hand side, please? Okay, can you roll back over now? Sir, how's the pain in your chest?
It's a little uncomfortable.
All right, I'll give you some more medication. Hopefully we can get rid of that pain. All right, sir, how you feeling now?
Okay, huh?